We turn now to the pandemic. Infections nationwide are now surging to their highest levels ever. Some school districts have already switched to virtual classes starting next week. For the second New Year's in a row, many celebrations were muted by COVID concerns. A crowd of just 15,000 watching the ball drop in Times Square. But unlike 2021, the Rose Bowl parade in Pasadena, California went ahead as planned. Last year's event was canceled months in advance due to the pandemic. ABC's Phil Lipoff is in New York for us tonight.
Tonight, one day into the new year, the record number of COVID infections continues to climb. Now, new concerns about a possible surge on top of a surge after New Year's Eve gatherings across the country. Like these in New Orleans, Las Vegas, and New York. The Empire State starting the new year with a single-day record, more than 85,000 new cases. The U.S. passing 2.2 million cases in the last week alone. But a bit of positive news out of the U.K., where the Health Security Agency finds people infected with Omicron there have reduced risk of COVID-19 related hospitalizations compared to those infected with Delta.
We are heartened by the fact that from the South African data, the data from the U.K., and the accumulating data in the United States, that it looks like it is less severe.
Still, nearly 100,000 Americans remain hospitalized this weekend with COVID.
With COVID, you're talking 2 to 4 weeks if you're lucky enough to get out. And unfortunately, especially among the unvaccinated, we're seeing a pretty high mortality rate still.
Pediatric hospital admissions are at a pandemic high as school is scheduled to begin again Monday. Districts across the nation weighing what to do in this COVID surge, some beginning the year online. Today, Atlanta Public Schools announcing classes will be held virtually next week. And after learning 25% of the 800 rapid tests administered to staff and students over the break came back positive, all public schools in Yonkers, New York's third largest city, will be remote.
This thing is spreading, especially to the little ones, and more kids are hospitalized.
D.C. public schools requiring all of its nearly 60,000 students and staff to provide proof of a negative COVID test before they return Wednesday.
There you go.
In Castro Valley, California, this district handing out free rapid tests in the hopes of resuming in-person learning.
We want to make sure that everyone takes a test before they come to school.
Children must test negative on Sunday to resume class on Monday. In Massachusetts, the Teachers Association wants to close schools as a precaution.
We close our schools because of the danger posed by weather. This is a different kind of danger and equally important to close schools.
The governor pushing back.
There are a lot of tools and capabilities available to keep kids and adults safe in school.
A source telling ABC News the FDA is likely to authorize booster shots for children ages 12 to 15 next week. It actually could come as soon as Monday. And when it does, CDC Director Rochelle Walensky says authorization from the CDC will follow quickly. Terry?
Phil, thank you. We know many of you have questions, and so joining me now is Dr. Alok Patel of Stanford Children's Health. Doctor, some recent studies suggest Omicron may infect the body differently than the Delta variant, that it may spare the lungs. And it sounds like we're having the same experience here in the U.S. as in other countries that have dealt with Omicron, skyrocketing case numbers. So could it be less severe? What's the bottom line? How concerned should we be about Omicron, and how do you see it playing out here?
Well, Terry, the bottom line is that some early data, especially a report that was just released from the UK, including data right here domestically, does suggest that the variant is more mild than Delta. This is a good thing. It's resulting in less severe hospitalizations, less visits to the emergency department. And people need to remember that the vaccines still absolutely work against any variant. But here's the reality. When we have 400,000 positive tests a day, you're still inevitably going to have a large amount of illness, hospitalizations, and also exposures to people such as frontline workers, police officers, firefighters, and doctors who are then taken out of work, and that still could have disastrous consequences.
And serious consequence. You are at work today. Doctor, let's turn to schools. We know cases among children are soaring, and that, of course, makes it really hard for school officials across the country who must make tough decisions this weekend about the safest way to return to class after the holiday break. So for parents like me getting ready to send our children back to school, do you think we can keep schools open safely amid this Omicron surge?
I think it really does depend on the individual school district, the resources, what local transmission looks like. We know that over the past week, pediatric hospitalizations have soared past 60%. But we also, by and large, know that an in-person learning environment is optimal for children's health, not only for their academic knowledge, but also it's an extremely safe place for kids to be. We often are keeping kids in a safe environment, providing meals, noticing signs of abuse, taking care of their mental illness, all of it. But schools need to really weigh what they can do, whether it's testing to stay, staggering classrooms, mandating vaccines, all of it. We just have to all get on the same page and do what we can to protect our kids and give them that option of going back into school. But parents should be prepared for the fact that there might be a delay, especially in places where cases are surging.
Be prepared. Dr. Patel, thanks very much for that. Be sure to watch This Week tomorrow morning. George Stephanopoulos goes one-on-one with Dr. Anthony Fauci.